A 100-pound man had a 200-pound tumor. Such a rare case shocked the whole world. All the doctors and nurses came here to observe the shocking scene, which made the introverted Mike feel very embarrassed. At first, Mike's bottom of the spine was just a small lump. In less than 6 months, the tumor encircled the whole abdomen and grew to more than 100 pounds. The tumor blood supply was connected to the patient's own blood supply, which basically ruled it inoperable. But this hospital was willing to try to make a cell phone for Mike, not because of the money, but because there was a doctor here named Sean. They pushed Mike into the CT room, but the results of the examination shocked all the doctors beyond belief. It was less than a week ago. Mike's tumor grew another 10 pounds, and the blood vessels in it were actually thicker than human. The blood vessels inside were actually thicker than human fingers. If this is a surgery, a knife down is very easy to bleed to death. But Mike has had enough of this tumor, said he would rather die on the operating table, not willing to go on like this, which makes the doctor very difficult. At night, the doctor was drinking milk tea, saw the pearls stuck in the tube, so she instantly inspired. She felt that the use of Mike's own clotting factors to block the blood flow, so as to reduce the risk of surgical hemorrhage, but also to remove the tumor without blood loss. It was perfect, but not long after the operation began, Mike's blood pressure fell crazily, which greatly reduces the time of their operation. Time is running out. The doctors rushed to start the operation, but I did not expect just half of the surgery. Blood flowed out more than 8,000 milliliters. We must know that the entire human body's blood volume is only more than 5,000 milliliters only to see the doctor while the operation, while the patient into the plasma and platelets due to the growth of Mike's tumor from the spine, so one side of the cut can only be suspended after the tumor. To the man turned over, continued to cut the other side, but the doctor just turned him over. Mike appeared to be in a state of shock. At this point, the nurse knew that if this time no longer called for Sean, the patient may have to completely see God.